Hi, my name is Ned. This is going to be a short presentation giving practical advice for early career psychologists, mostly relevant to being in Australia. I've seen plenty of other videos out there that give more in the way of what I would call mental advice or psychological advice for coping in the early years of the profession, but I haven't seen much in the way of practical advice. So I'm going to do my best to be helpful here. I won't give a full bio here, but a full list of my professional qualifications and experiences can be found in the show notes. But no, launching straight into it, the big decision that I think most people are facing once they graduate is whether or not they're going to pursue employment in the public or the private domains. I'm just going to quickly look at those two options side by side and hopefully describe some of the obvious pros and cons. Biggest difficulty that most people have in the public sphere is the level of bureaucracy that you're going to have to be working within. You're going to have to meet a lot of KPIs. You're going to find yourself going to a lot of meetings and doing learning modules about things like work health and safety. You're in general going to be spending a lot of your time doing things that aren't really related to psychology. You compare that to the private sector, you will be effectively doing what is probably the closest thing to what you imagined the profession being when you first started to find it appealing in your mind and gravitating towards there with what you were going to study at university and that sort of thing. In the public sector, you're going to often be doing a very specific and very repetitive set of tasks, or maybe even the single task, especially early career. You might just have a single pro forma sheet that you have to go through or a single screening tool, and it might be your job to just go through it again and again, hundreds of times with different clients, and that's most of what you do. On the other hand, in the public sector, there's much more opportunity for career advancement and transitioning into different sections within the department or maybe a different department altogether. You compare that to the private sector, you will be working with clients, and every single client will be quite different from one another. But on the other hand, the very first day you work in the private sector will not be practically all that different to the very last day you work in the sector, even if that is several decades later. You'll be sitting in the same room, maybe in the same chair. In the public sector, for me, this is probably the biggest advantage to working in a big institution like the department, one of the government departments, getting to be a part of a big team. Again, especially early career, it's nice to be able to work alongside other psychologists, see how they do things and learn from them practically as you co-facilitate things. It's also multidisciplinarian, or more likely to be that. So you get to hang out with nurses and social workers and psychiatrists and doctors and learn how the different allied health professions operate. Compare that to the private sector, you're mostly, almost entirely going to be hanging out by yourself and with your clients. Even if you join a fairly large practice with maybe a dozen other psychologists in it, you'll catch them in the coffee room, but then ultimately you'll all go back to your own offices, see your clients, and be working in isolation. Um, and I suppose by the same token, in the public sector, I would say there is far less pressure on you. It is generally a less stressful occupation, given that you're a small cog in a big machine. And if you are having a bad day or aren't quite up to things, the show will go on without you, without too much of a blip. You compare that to saying taking a sick day in the private sector. It never feels comfortable to do that because it's quite typical that you might need to contact 6 clients in advance and tell them that you're not available that day. And in certain instances where they might be quite dependent on you as their chief means of psychological intervention. Maybe they are also taking the entire day off to come and see you or had been planning to anyway. And then just one other addition to that, in the private sector, they are probably going to be paying money out of pocket, possibly over $100 just to come and see you for an hour. And for most people, that's going to put a higher level of stress just on your day-to-day work role. I'm just going to quickly compare the typical salaries side by side, if you join the public sector uh, first year out of university, there is a fairly good chance that you will be earning exactly $88,255, as that's the current starting point for allied health professional level two. So that's what most roles will be packaged at. And out of the side of the government, most NGOs, the salary will be somewhat comparative to that figure. When you're looking to compare public and private salaries side by side, it is important to remember that if you are in the public sector and receiving an annual salary, this will also include superannuation, and it will also include paid public holidays and your annual and personal leave. You compare that to the private sector, you would just get a bulk sum of money, and then it is up to you with that to pay your tax, contribute to your super, and pull money aside for when you have to take leave. Even with all of those things considered, in your first year, if you went full time into private, you'll probably, I would estimate, be earning about 10 to 20% more than what you would be in the public sector. And that will actually increase probably for the first 5 years of your career. Some practices will incentivize you to stay with them by giving you a higher increase of the split of the client fee the longer you stay there. And also, particularly if you're in the clinical registrar stream, once you make the requirements for clinical registration and you have access to charging the higher Medicare fee, your salary will substantially increase as well. So that's usually at about the 2 year mark for most people. What I said before about the percentage of client fee, this is just a few dot points I'm going to make. If you do decide to go private, these are some things to consider. Splitting the client fee is what's going to be happening in most practices. You'll be employed as a contractor. The client will pay their fee, and then a percentage of that will go to you, and then a percentage of that will stay with the practice so they can employ admin staff, do marketing, pay rent, and keep the electricity on and the tissue boxes full. From a sample size of about 6, I'm pretty sure I'm right about this. The average split tends to start off somewhere between 55% and 60% in favor of you, the contracting psychologist. I could be wrong about that, and it also might differ in different states and territories, as my sample size of around about half a dozen is based purely from Adelaide practices that I'm aware of. Certainly, I would say that if you are offered anything less than 55%, I think that is a pretty good reason to possibly consider doing more interviews. If you are offered anything more than 60%, then I would say that that is a pretty good wicket to start with. A quick point I would make about choosing a different private practice. One thing that I've found is that overall, the client population that you will be working with won't feel all that different depending on which practice that you're working at. Generally, the clinical population or the public that access private psychology tend to be about the same. You're going to have a similar variance of clientele. So having said that, when choosing a practice, I think the best bet is to go with, if you can identify this, which supervisor you would feel the most comfortable with doing supervision, especially if you're doing the registrar program. And to determine that, I encourage you to gossip a lot with the rest of your master's cohort or the people that you know who have been doing placements at the same time as you. Trade stories about how things were and make a decision based off that. And if that doesn't work, I would just choose a practice that is closest to where you live, given there are many, many clinics throughout the city and suburbs, and that is usually a pretty safe bet for quality of work life. There are a couple of warning signs that I would flag when considering different private practices, just a few things you might want to consider. Some private practices will have an expectation that if you work for them as a contractor, that you still contribute to some of their marketing strategy, such as writing blogs and maybe managing their social media accounts. And that's not the biggest deal in the world. It doesn't take up heaps of time, but it will be unpaid work. And also not every practice has that requirement. Some practices I have heard will charge you for supervision. And again, if you are looking to undertake a registrar program, which is going to be 80 hours, usually over 2 years, this could be something like $10,000 deducted from your pay. So it is worth considering that before you sign up anywhere. And then finally, some practices will have you sign a non-competition clause in your contract, which is to say that if you were to leave them, there will be, I've drawn a map here, there might be a certain radius and for a certain period of time, say to 3 to 12 months, that you are not allowed to join another practice without risking some type of litigation. So those 3 points there aren't necessarily deal breakers. You might have a practice in mind that does all 3 of those things, but you might still have a very good reason to join them. But certainly I would just consider that it's worth knowing and thinking about those 3 things. One extra point I would make here is I remember in the 6th year of studying psychology, when we were all just about to graduate, I remember there being a lot of anxiety around the cohort that I was with about who had secured work yet, where people were going to go, and almost like, are we all going to have employment? Trust me, that is not something you need to be worried about. I have yet to come across a psychologist in Adelaide that was having trouble finding work. Everybody will get a job. And in fact, quite often, particularly in early career, people are changing jobs quite frequently as better opportunities present themselves. So you can afford to be a little bit choosy here. A deliberation that I think a lot of people consider as well at the beginning is whether or not they're going to work exclusively with adults and or children. So I'm just going to quickly look at those 2 options side by side. Adults, again, I would say that that will be the type of work, particularly, again, I guess I'm talking about here in private practice, that will be the type of work which is probably the most like what you imagined being a psychologist would be when you first started entertaining the possibility of trying to pursue that career. You'll be sitting in a chair opposite another adult in a chair talking about feelings and their journey through whatever struggles they are going with. An important thing I think to flag here is a fairly decent portion of your adult clients, and I would say roughly about a third, will be incredibly easy to work with and incredibly satisfying and fun. You'll meet a certain portion of people just at a point in times of their life where they're just ready to make some pretty beneficial, substantial changes. They'll be highly motivated, they'll be highly appreciative, they'll do all of the tasks that you and they come up with. And it's incredibly satisfying to watch that sort of improvement and personal transformation play out in front of you. And in a way that doesn't quite happen with kids, which I'll get to in a minute. Probably the most stressful aspect of working with kids, and again, this is more so when it comes to private practice, is there will be instances of risk that falls almost entirely onto you. So keeping in mind, children have guardians that will come to session typically with their parents or someone looking after them. And whereas with adults, you're going to have a certain amount of clients that are severely depressed and severely isolated, and you might be the closest thing they've got to a guardian. And in extreme instances, you might have to, in the course of your session, arrange an escalation into mental health triage and hospital attendance, ambulance attendance or something like that. And that's a pretty big call to make, because sometimes it's obviously the right thing to do. Sometimes they're obviously safe to go home by themselves. But then there's borderline cases where it will be a tough call to make. And on top of that, you might have another client in the waiting room waiting for their appointment to start. But you have this situation in front of you which you can't ethically move on from. So that is not a common thing to happen, but I guess I'm just expressing that story or scenario just to give a bit of a taste of what working with adults can be like, probably in what, in my opinion, would be its most stressful type of circumstance. So working with children, I think a strong advantage to doing it is it will be a very good way to become a competent psychologist. You will do a lot of very practical differential diagnosis, case formulation, and seeing treatment through to its eventuation, pretty much like it is written down in the textbook. And this is a way that I don't think is ever as simply done with adults who have all of the baggage of their history and personalities coming along with the presentation. Whereas children come with a parent, the parent says, this is the difficulties that we're having. You can use your training and expertise to work with that, to identify what the situation best is. And also the parents are very great for providing the accountability to do the homework exercises that would be required to get the intervention to manifest into improvements such as exposure therapy or self-monitoring. Another advantage to working with children is there's arguably a much bigger impact that you're having on an individual human. I've just created this very modest little graph to demonstrate that you imagine at the age of 9, the psychological intervention takes place, which might not be anything all that radical or surprisingly nuanced. It might just be the simple concept of learning at the age of 9 that, hey, when I'm stressed out, my brain doesn't work very well. I lose my capacity to empathize. I lose my capacity to have decent consequential thinking. It's best I don't make a decision in that moment. And if I can just chill out, wait till I'm calm again, and then I make a decision, I'll be in a much better position. And you learn that or something like that at the age of 9, you're going to do that several dozen times prior to the age of 25. And not only will your life be in a much better situation, you're going to have a different personality to what you would have when you were otherwise without that intervention. So I don't want to be overly grandiose with what we're accomplishing here, because in psychology, you never know exactly what the impact you're having is, especially when you look at things long term. But I just think logically, this has to make sense. This has to be occurring on some level when you work with children. Biggest, I would say, stress factor to working with children is a decent portion of your child clients will come from separated families, and often you will meet them right when that separation is in its most chaotic and hostile. And often you are going to find yourself in a fairly similar position to the actual child in the family, where you've got two, I guess, competing parties wanting your approval or wanting your alliance with them, or certainly it will feel like that, or they put that pressure on you inadvertently in many number of ways, and you do your best to try and stay neutral, to try and say anything without annoying someone, which is often impossible. And quite often you're going to be getting your notes subpoenaed for the purpose of family court. So that's part of the parcel with working with children. Not a reason to not work with children, but probably again just I offer that as a description for what the highest stress levels of that sector can be. In a nutshell, I would conclude and recommend that if you have the option of working with both, do so. In fact, if you have the option of working with adults and children in private and public, a lot of people will do this by taking a 3-day-a-week part-time public job and then working 2 days a week in private. That is a good option if you can do that. It will be a steep learning curve, but no matter what you do, it is going to be a steep learning curve in the first couple of years of your profession. As I said, I wanted to make this video as practical as possible. I will just give basically a singular piece of general advice. Number one is don't be too quick to drop CBT. One of the things, if you haven't heard it yet, you're going to certainly hear it sometime soon. It'll probably be said by one of the cool kids in your cohort that they're not really into CBT anymore. I would just, I'm going to probably make another video where I'm unpacking this a little bit more, but I would just say hesitate and don't be too quick to jump on that bandwagon. Number two, I've read about half a dozen or so of all of those pop psych, early career, how to be a therapist books. They're all fine. My favorite would probably be this one, which I've just put up here on the screen. Just a real quick plug for my own practice. I'm based in Wayville, where I see adults on Thursdays and Fridays. If you are in the mental health sector and would like to see a psychologist for some type of intervention with a mental health care plan, I charge a $40 gap concession fee for anyone in the mental health sector. So if you would like to ask me any more questions or any questions, you're more than welcome to email me. Otherwise, I hope that this video has been helpful. Thank you.